morning, friends. I'm here at Medical City with Dr. Tony Piano, neurologist, one of the proponents ng natural cures for Parkinson's. Sa Dance with Parkinson's, I was able to feature that in my blanks. I was there, and I'm glad that I am here now with Dr. Tony to be interviewed. Dr. Tony, how are you?
Thank you, sir. Thank you for the opportunity also to be in your blog and to share about Parkinson's. Opo.
Yes. What's happening now, Dr. Tony?
So right now po, we are here to promote awareness on Parkinson's disease. So we invited different people from the different barangays in Pasig, as well as our other support groups. And this is mainly po para ma-educate namin yung mga tao regarding what is Parkinson's, how we treat Parkinson's, and then what are the alternatives in treatment, particularly exercise and rehabilitation, sir.
I see. So maybe consider me as one of those uneducated so far.
Hindi naman. I saw you na eh. So dapat educated ka na, sir.
A bit, yes. A bit. I mean, for the benefit of our viewers,
Yes.
What do you think they should really know about now, about Parkinson's?
Okay, so for Parkinson's, it's important for us to know that this is a tinatawag nating neurodegenerative illness. Ibig sabihin, dahan-dahan pong nasisira yung part ng brain na mas mabilis compared to the normal healthy individual. So in Parkinson's, one area of the brain that is responsible to make your movement smooth, no? Nasisira kaagad. And this brain cells or part of the brain produces dopamine. So in Parkinson's, nauubusan po tayo ng dopamine, no? So the usual treatment for this is actually to replace the lost dopamine. Alright po. So manifestation-wise, for Parkinson's, commonly yung mga napapansin ay ang mga pasyente may mga panginginig, pero yung panginginig nila kadalasan ito yung makikita kapag nagpapahinga. Alright, and it will worsen kapag gumalaw sila or na-stress sila or pag nagalit, ganyan, or tensionado, mas malakas. On movement, nawawala, pero sometimes pwedeng bahagyang bumalik. Pero another more important feature ng Parkinson's is bumabagal ang pasyente, no? So, mabagal ang pagkilos, pag nagsasalita, bumabagal, ang pagsusulat lumiliit, no? Nagdidikit-dikit ang panulat nila. Yung usual na gawaing bahay is also affected, like taking a bath, no? Eating or feeding oneself, or turning in bed could be also affected. And then they also have tendencies to have a funny walk, no? Because mabagal sila mag-walk, so minsan they feel that they're also stuck on the floor. They also shuffle, and then they're also a bit stiff. So these are the more common symptoms for Parkinson's disease. And then we usually advocate that if you feel that you have any of these symptoms, you always see your doctor, no? Preferably either any doctor, but preferably a neurologist.
And you are advocating mga exercise you mentioned earlier.
Yes.
Can you elaborate further?
Yes. So exercise is a very important part of management ng Parkinson's, no? So there are many different ways to exercise. I think you mentioned in your previous vlog, no? When we were in Makati Med, which is dance. That's one very important form of exercise because first it raises your heart rate, no? So it's true exercise. You deep breathing, you can sweat, and then at the same time it improves balance and posture, no? Which is usually affected po in patients with Parkinson's. Alright, so any form of exercise should be helpful, no? But I advocate mainly aerobic exercises. So the walking, alright, as long as it's with a partner para less in risk to fall. Dance, kasi usually you have a partner to dance, no? So that will also help you in case may chances come to fall, somebody is there to guide you, no? And then swimming, probably if you know how to swim, should be helpful. Alright, but generally any form of exercise that you enjoy, importante enjoy ka, should be advocated in a patient with Parkinson's.
From your experience, Dr. Tony, regarding your patients, what are their usual worries when they are diagnosed with Parkinson's? What are the usual worries? How do you approach them?
Yeah, that's a good question. No? For commonly, mga unang worries nila is because you tell them na walang treatment. So, feeling nila wala nang say-say yung life nila. No? Because they feel that it's a degenerative disorder, no cure. So, feeling nila nagiging useless sila and then they're afraid of the consequences. But commonly, what I tell my patient is that we have medicines that will help the symptoms so that you can live a better quality of life. Right? So, like I said kanina, somebody asked, no, ang Parkinson's ba nakaka-shorten ng lifespan? I said yes, it can shorten lifespan, but sometimes it's not the length, but the quality of life that you live, no? And it applies to not only patients with Parkinson's, but for everybody else, no? So, you try to live a good quality of life, enjoy your family, enjoy your friends, it should not be a hindrance. So, yun yung unang-unang common na problem na encounter ko with patients, no? Na they feel bad about it. So, they are also at risk for depression. So, if I recognize it and I cannot counsel them on that, then management with medicine should be at the back of my mind kung kailangan ko silang simulan or hindi. Another concern would be the effect of the medicine. So, once you start them with medicines, they will start to have sometimes side effects. So, you just have to explain extensively kung ano yung mga pwede maging complications, tapos ma-recognize early so that we can adjust the medicines properly. In later stages of the disease, when their medicines are medyo nagloloko na, meaning mahirap na siyang timplahin, no? Then the main problem or concerns of these patients are now the side effects, no? The excessive movement, and then sometimes they develop pain. So these are the complaints in the middle or latter part of the disease. Pag medyo matagal na, it's mainly because the medicines don't work anymore, kahit mataas na yung doses, then that is the time that you have to start telling them about comfort, alright, and then making sure that the family knows that this is going to be a problem na dapat i-address, na the patient is very comfortable. So usually those are the parang stages and at the same time the common concerns of my patients when they are told that they have Parkinson's.
Among medical service providers,
Yes.
mga doctors,
Opo.
is there a practice na that they're doing? Somehow you're concerned na gusto mo ring i-modify or to have them be updated on?
Oh, yeah, that's a good question. Now, actually, at least the Philippine Neurological Association, the Society of Neurologists in the Philippines, are actually advocating to educate our physicians. Not only the neurologists, but also all other physicians. So there's always a move for that. Interestingly, we're going to have, it's on the works, pero so, unang-una sa vlog mo malalabas to, wala pang announcement, formal announcement, but I'll announce it in your blog site, no? That we might have a national lay forum conference, but this is mainly for lay. For the doctors, the Movement Disorder Specialists, or MDSP, Movement Disorder Society of the Philippines, has always advocated in educating our other physicians to recognize. And then, if they can manage, let them manage. If they feel that there is difficulty in management, that we're here to help them.
What about the caregivers at home of patients? What have you observed in their relationship or interactions with the patient? What can you say or advise to them?
That's a good question, no? So, for all illnesses, similarly to Parkinson's, like Alzheimer's, no, caregiver burden is a big aspect. So, this conference or this lay forum is going to actually be a series of conferences, and that's one of the topics that I want to discuss, no? To how the caregivers address patients with Parkinson's, particularly knowing their limit, knowing that they need to rest, alright, recognizing that the patient is going to move slow so they don't have to rush them, and also recognizing that they are the bigger, or they have the bigger chunk of responsibility in making sure that these patients will have a good quality of life. Alright, so madaming aspects, particularly caregivers. So, commonly among doctors, hindi lang pasyente inaalagaan mo, pati yung caregiver. Because for the patient to be healthy, the caregiver should also be healthy. And at the same time, all the stakeholders around the patient should be talked to and then addressed para maganda yung care natin for the patients.
What about Dr. Tony, about the general public in general? Would you like to say something?
Yes. It's important that you recognize the symptoms of Parkinson's. No? Kailangan natin antabayanan kung ano yung mga simptomas. And at the same time, if it's recognized early, then it's good that you discuss it with your doctors. I'm not just saying just a neurologist, but any doctor, no, na kakilala nyo para mapag-usapan.
Stigma. Is there kind of a stigma pagka-patient ka ng Parkinson's?
That's true, no? There is, yes. Yes, actually there is, no? So, I've had a couple of patients who are actually hesitant to come out because they are labeled before na easily mga mababagal, people who might not be contributing to the society anymore. So there's actually a stigma. But it has to be important. I think that's why education is important and information dissemination should be important, because one aspect of battling stigma in any illness, not only for Parkinson's, is that if people are educated about it and they know what it is all about, then you lessen the chances that they will stigmatize or they will judge other people with this illness. So, like any illness, I think there is a stigma for Parkinson's.
Dr. Tony, thank you for educating me.
Thank you. And thank you for your help.
Yes.
Thank you.
Ron Kumagun with Dr. Tony Piano, a neurologist from Medical City. Thank you, Doc.
Thank you, sir.